Right, right. And I'm glad to be able to have this conversation. There's so much going on right now. I heard earlier, like this week is like Restorative Justice Week. Um, there's a lot of things that we need to celebrate, and like and also like things like acknowledge, and commemorate, and just really be mindful of as we
Yeah.
think about this week. Um, the other thing that's coming up, and I just want to do a quick thing. Giving Tuesday is a week away,
Yep.
and that is a really important time for nonprofits like Men Healing, and other nonprofits that are really doing this work that's really meaningful. That sometimes doesn't get acknowledged for
Yeah.
the amount of effort and the work they put in to support people with healing and to serve people who wouldn't otherwise be served, if it were not for the efforts and the work of people like you, Michael, and healing. And for those of you who haven't participated in any of these IG lives, Men Healing is really committed to creating space and supporting the healing journey of male survivors of sexual assault and sexual violence. And it's one of the few organizations in the country that really creates a space for male survivors to heal, to come together and connect with one another in ways that is essential to their healing journey. And we have been doing this 90 days, 90,000 campaign to raise money so that we can ensure that access is never a challenge for anyone who wants to take advantage of the healing services and the support that they need through the weekends of recovery, the day of recovery. And we're just over $30,000, but we're really looking to to break that, to shatter that, and get to a place where we can make it more accessible. And so, with that said, I see Michael kind of got knocked out, and I'm gonna bring him back in. I'm gonna bring him. All right,
There we
Michael.
are.
All
Sorry.
right, good.
I was listening
Well,
to you keep on going. So it's
you
good.
missed the like commercial portion of it, but like,
I
um,
heard it. I just couldn't, I just wasn't on screen. So sorry about that. You're doing a good job, Richard.
thank you. Yeah, they
You
really
got it
broke me.
down.
It's like full immersion with the IG live piece.
Yeah.
And I work with Men Healing as their anti-racism consultant for their weekends of recovery. So this has been happening for about a year now. It seems time has flown by.
Yeah.
But Michael, enough about Men Healing. Enough about me. Let's talk about you. Let's talk about like the work that you do and your connection to Men Healing. I mean,
Yeah.
yeah.
So, before we do that, what you were just saying is like so important too, like about
Mhm.
like where we are in this place and time. So, I've been thinking about our conversation today, and I was thinking like I'm in Wisconsin. So we
Mhm.
had the Kenosha decision about
Mhm.
Rittenhouse. We had the
Mhm.
parade,
Mhm.
and there's just like a whole bunch of stuff that's happening in the world right now. A lot of it's
Mhm.
around race, a lot of it's around violence, whether it be
Mhm.
gun violence or whatever else. And then we just had Transgender Day of Remembrance on the
Mhm.
20th. So like we're setting up for this call with like a whole bunch of stuff happening in the world, and those are just like
Mhm.
a couple of small little things. So that's kind of like what we're moving into this week with, I think, for a lot of folks.
Yeah.
um, but anyway, to answer your question, so Men Healing,
Mhm.
I am so thrilled to be part of the board of directors,
Mhm.
and with some special kind of projects that we have joined together between Forge and Men Healing. So Men Healing brings me so much joy. My partner is always like, I'm not sure what my partner feels about my joy about Men Healing, but
Mhm.
it's really exciting to be part of an organization that has so much integrity and so much transparency and all of those good qualities in an organization that really shine bright.
Yeah. Yeah. So Michael, I mean, like, um, that's so crazy because Michael and I have worked in the past on other projects, right? You realize like when you get invested in this healing work and supporting people who unfortunately may not have access to the resources that they need to heal, you realize that this is a really small world, right? And so we come to find out that we're connected in a variety of ways. Michael, talk a little bit about Forge and the work that y'all
Yeah.
do. Yeah.
Yeah, cool. And so, Richard, you just mentioned, the work that we've done before. We definitely have been in the same spaces before.
Hmm.
So, Forge is a national trans organization that is specifically focused on anti-violence. And
Hmm.
within that anti-violence realm, it's mostly sexual assault, intimate
Hmm.
partner violence, stalking, and hate-motivated crimes.
Hmm.
So we've been involved in projects like maybe, Richard, you might know about, like the National Center for
Hmm.
Reaching Victims, which has just a ton of resources on it, as well as, resources that Forge has generated and all of the partners in that project that
Hmm.
we all generated. So we do both direct service and training and technical assistance at Forge. So a lot of our work is really spent on training other providers to do a better job with trans survivors of sexual assault and intimate partner violence.
Yeah. Yeah, I appreciate that. And I mean, I was immediately struck, like in the past, like when we met, about the work that you were doing, and really just thinking about it, like on the previous project that Michael mentioned, like we were focusing on specific underserved populations, and I was focusing on boys and men of color as identified research identified underserved population that has not received the services and support that they need to heal. And one of the things that kept coming up for us as we continued to do this work was like, what about trans men of color?
Right.
And that was something that led me to have to do a little bit of research,
Mm-hmm.
but I didn't have to do much, right? Because Michael was on the team and doing that research, and so like kind of really informed like my perspective and like my understanding and awareness of the impact of violence on trans men of color. And it's something that really opened my eyes in a way that unfortunately I didn't consider. But
Yeah.
once I did, I was like, okay, I knew that any type of convening, any type of conversation, any type of work that I was doing, it had to be, considerate of the experiences of trans men and boys and men of color.
Exactly. And I think what you just said is so important because, like, when we work together, not you and
Mm,
me, but like when people work together, we learn about other people's experiences and go, wow, I need to bring this forward in the work that I'm doing. So, like, you've done that. And, we don't need to talk about our prior work together, but like, there was a lot of things that came out of that that really mirrors what's going on with Men Healing, about social justice, about racial justice,
mhm,
about all of those things that many of us care deeply about, but how do we
mhm.
learn more about it? And it's like we learn more by connecting with other professionals, connecting with other people. And I think that, we've had the privilege of doing that. And I love this Instagram Live series because it's highlighting different people and different organizations and different things that we should all be caring about and we may not
Yeah,
know about. Yeah.
yeah, absolutely. And like the overlapping ways in which our
Yeah.
lives are impacted, right? And if you think about it, just knowing that trans men of color like have like the highest like rate of encountering and experiencing violence was like so critical to my awareness, right? To say
Hmm.
like I'm doing this work around boys and men of color, and I did not have this awareness,
Right.
right? I didn't
Right.
know this because it's not something that's like being so like the work of Forge is so critical and making sure that that information gets out there and that also people are invested in, making sure that the services and support are available.
Yeah. And
Can you talk
unfortunately,
about that? Yeah.
yeah, definitely. I mean, because like that is so critical because the services are not available to a lot of trans folks, whether it's
Hmm.
trans feminine folks, trans masculine folks, non
Hmm.
binary folks. I mean, people can't even get in the door most of the
Hmm.
time
Hmm.
because services are set up to be like for women. Because
Hmm.
that's what our culture is. It continues to be that sexual assault is this violence that happens by men against women. And that is just such a dangerous, thing to think about because that's not the truth, but that translates into what services are available. So, trans people of any gender vector are oftentimes just literally turned away at the door. Or if they
Hmm.
get in, people are not culturally competent. People are not culturally responsive. People say
Hmm.
stupid things or, inappropriate things. And that makes survivors say, well, this place is not for me. I'm gonna go on.
Hmm.
And that results in obviously, unhealed trauma for folks and all of
Hmm.
those health disparities that come from that unhealed trauma. So it's a snowball effect when people don't get access
Yeah,
to those services that they need and deserve.
absolutely.
Yeah.
Absolutely. And I feel like one of the things that comes to mind is like even the most like well-intended person, like therapist, social worker, advocate, like if you are not aware, and this is something that was important for like, the work that we were doing around boys and men of color is like,
Yep.
yes, you can be well intended, but like you have to be able to conceptualize and contextualize the experience of interpersonal trauma for
Yeah.
boys and men of color within this broader framework of social justice, of racial equity, of white supremacy, of patriarchy, in order to understand the nuances of their responses to that intimate expression experience of trauma. And so could you talk a little bit more about that, like how that might manifest itself in the experiences of trans folks and these broader contexts and frameworks that we need to consider?
Yeah. I mean, what you just brought up is tangential to ACEs, so the adverse childhood experiences. So different people from different experiences are going to have higher or lower rates of ACEs. And, we don't need to talk about ACEs right now, but, when trans kids are bullied in school, when trans kids are not allowed to play on sports teams, that all affects their ability to be in the world and believe that they are an okay person, believe that they have a right to not be harmed. So, there's some simple things like that providers don't recognize the connection between, for example, childhood bullying and sexual assault, or the belief that healing is possible. So again, that kind of puts it in that cultural context of how do people heal, but do people believe that healing is possible? What things inform that before they, even consider going into a therapist's office or a support group or a weekends of recovery. And just a lot of people are just not going to be there because of what they've been told their entire life.
Yeah.
And that's sad. It's really sad.
Yeah, it's sad, and it's something that we can change, right?
It's
sad, but it's something that we can change, and that's the reason why you're doing the work that you're doing. That's the reason why I do the work that I'm doing. And one of the things that is always very critical for me when I talk to any service provider, anyone who's working with, especially if you're not a person of color, right? And not to say that people of color, have this like monopoly over the process of supporting the healing journey, because we all know like there's so many other factors that contributes to like how you engage and support, right? Just because you're a Black person doesn't mean, you have to conflate your Blackness or your maleness with, the experience of trauma for other people. It doesn't make you an expert. It means that you've lived a life as a Black person. It means you've lived a life as a male, as someone who identifies as a male. But at the same time, you really have to check your own bias. And that's something that I've always emphasized. Like the best way to like support someone who identifies differently is to like really reflect on your own biases and the things that you might have internalized that can influence the way that you interact and you show up for other folks. And so I've always emphasized that. Can you speak a little bit about that and like, some ways that like, providers, advocates can like take that in consideration and start to practice that when they think about?
Yeah, that's a really good question. And, bias is one of those things that, a lot of us know about and think about, and we can think about explicit bias and implicit bias and, all of those different kinds of things. And it's really important, I think, to pay attention to that, the implicit biases that we have, and we all have them, right? I mean, we have them about lots of different issues. And I think that, when people don't realize or don't want to pay attention to, well, why am I thinking the way I'm thinking? About men, about women, about sexual assault, pick about race, about age, about any of those things. I think a lot of people just kind of go on autopilot. They're like, well, I know how to do my job. I'm just going to do my job the same way with everybody. And that doesn't work, right? It doesn't work when we don't say, well, let me put myself in somebody else's shoes for a second. Or let me think about what words that I just used that might be hurtful, or what my body language is when somebody discloses something. All of those things really make a big difference. And of course, it makes a difference for trans folks, for folks of color, for folks with disabilities. We can go on and on about all of those different kinds of groups of people or populations where it does make a huge bit of difference if we don't pay attention to what we're thinking and what we're doing. And I think, when we train folks at Forge, we always, remind folks that they know how to do their job, right? Like hopefully like a therapist knows how to do their job, hopefully. But we also remind folks about if they stay person or survivor centered, they're going to do a really good job. So what does staying person centered mean? What does survivor centered mean? That means paying attention to what your story is, right? It's paying attention to what that person's story and history is, rather than making assumptions. So it kind of addresses what you're talking about with bias. It's just like literally kind of stepping into somebody's shoes and and thinking about what it means. Yeah.
Yeah, yeah, absolutely. And I think in addition to what you're saying too, it sounds like and you know this is like a level of humility that's required,
Right.
right? To say that I don't know.
Right. And that's okay. That's really
Hmm.
okay. About saying, I'm sorry, or wow, this is new to me and I don't know. And then obviously we want to make sure that, like, for trans survivors, we don't, as professionals, don't rely on trans people to be their educators, right? So
Hmm.
we want people to get information from other sources so that it's not interfering with
Mm,
that therapeutic
that's a great
relationship
point.
or that
That's a
group
great point.
dynamic or whatever that professional relationship is. And that's so common for trans folks and a lot of
Mm,
populations of doing that education when it shouldn't have to
mm,
be necessary.
that's a really good point because, yeah, I recently had an experience like that when someone was asking, it was a white person who wanted me to do some work with them, and they had all of these questions, and I was just like,
Yeah.
Google is really helpful and like help, like
Yeah.
bringing some awareness to this. Like you can find a
Hmm.
lot of information. So like, I
Yeah.
get that you want to be anti-racist. I get that you're
Right.
like invested, but some of that is like evidence through your effort and the work that you put in of getting
Hmm.
information before you try to make the person,
Yes.
right, the one
Yes.
who teaches you, because you put
Hmm.
an
Yeah.
additional burden and responsibility and onus on them
Right, exactly. And I
to
think that's
educate.
so critical too when somebody is paying for services. I mean, it's like,
Mm-hmm.
it's not good when it's not paying for services, but like when you're a person that's paying for services and that provider then says, "Oh, you need to teach me." That's like this extra level of, I don't know, burden, responsibility. And yeah, it doesn't mean that the provider's not taking responsibility
Mm-hmm.
for doing what they need to do. So yeah, totally. Totally.
Yeah. So tell me a little bit more about like how the work of Forge kind of like forges with the work of Men Healing and like how
Yeah.
there's a connection.
Mhm. Yeah, there's a connection in lots of different ways.
Mm-hmm.
We have shared values, which is really, one of those cool things. Um, but when we look at things like the minority, oh, actually, let me start over. It's not really the minority. When we look at kind of why men have such a difficult time accessing healing, recognizing that sexual victimization has happened. Some of those things are true for trans folks as well. Some of the
Mm-hmm.
barriers are the same. Because again, I think that the primary reason is that we live in this culture that's violence against women. And so if you can't see yourself in a violence against women paradigm, you're not going to reach out for services. You're not going to even recognize that what happened to you is sexual victimization. Because if you don't identify as a woman and you've been sexually victimized, where does that put you? So I think that that's one of the things that we have in common, is that most trans people, there are some trans people obviously that do identify as women, but may not have been raised as women and all of those kinds of pieces. And so there's a parallel there. There's a parallel with shame and added stigma. There's a lot of things that are really right on.
And now, are there any ways that you're like bringing the lessons, the knowledge, and the skills that you've acquired and that you've incorporated into the work of Forge to Men Healing to support survivors who participate?
I hope so. Right?
Mm-hmm.
I hope so as a board member. I hope that we all contribute something.
Mm-hmm.
Um, and it's one of the things that I love so much about Men Healing is that it's this mutually like learning kind of engagement where
Mm-hmm.
we're all like personally looking inward. We're all trying to connect with each other and learn from each other. And I think that that's really remarkable about Men Healing as an organization. And at Forge, it's just commonplace. I mean, it's just what we do as well. And I think
Mm-hmm.
there's like a similar value too in that we're all kind of looking inward to see what's true for us, what's true about racial justice, what's true about social justice, and how do we reach out, with that. So we have knowledge because we look inward,
Mm-hmm.
and we look inward with each other as well as personally. And then how do we make steps to make our organizations better,
Mm-hmm.
whether it be about racial justice, social justice, pick the environmental justice, all of those things that are interwoven together that
Mm-hmm.
people may not think of as related, but they are.
Yeah. I think, and I would love to hear more about this too, because it's like, we have this knowledge, like we said earlier, like people have access, like the internet is just expose us to so much information that we can gather if we're committed, if we're really invested in learning more about the experiences and the struggles of other folks who identify differently than us. But then there's also this fact that there needs to be like advocacy and systems change work, right?
Yep.
To make sure that, people can not just get the services, but systems are changed in a way that creates more equity, right? Equitable distribution of resources that requires people to do that work. Because unfortunately, we find ourselves in a position, in a predicament where sometimes you have to legislate morality, right?
Exactly.
Are there any efforts like legislative advocacy efforts that you would share with folks about the work that Forge is doing?
Let me span broader than that, because I think when we talk about systemic things, it's not what Forge is doing or what any organization is doing, I don't think. But when we look at legislative things, which I think are really important, like even if there's laws, they don't necessarily make the world right, but it helps, I think, to have things in place that are protective of individuals or groups. We know that things like conversion therapy still happens. Well, how does that impact trans people? Right? We know that there are still bathroom bills that affect if somebody can just use the public restroom. Like, we might think, well, what does that have to do with sexual victimization? Well, it has everything to do with it, because it's saying that one group of people is less than another group of people. So, when we look at legislative efforts, it's like, well, how do we at the local level or the state level or the federal level change some of those discriminatory laws? And in some ways, we've gotten a kickback, a good kickback, with the new administration versus the prior administration, where things like Title X, removed protections for trans folks around sexual assault, and now that's back in place. Or Housing and Urban Development made anti-trans shelter rules, and now those are reversed, and so trans folks can more easily get access to shelter. Still difficult. So those are some of those big policy issues that need to feed down. And even if there's policies, right, again, they're not getting put into practice. So we have to figure out on those local levels, on the grassroots levels, how can we support and uplift the non-discrimination types of actions that are taking place.
Yeah, and I do want to. I actually want to go back, right, because you mentioned two things that I think we kind of assume that people do know, right? Could you elaborate a little bit more on that for folks who may not know what those discriminatory practices, those two particularly that you mentioned? I think
The
it's
Title
important.
IX,
Title IX and bathroom discrimination, and
Well, bathroom discrimination is not federal, so it's state by state, local by local, school by school, and it's basically saying that trans kids or trans adults who identify as women or identify as men or identify however they identify their gender can't use the bathroom that aligns with that gender. So there's been a lot of legislation around that. Same with trans youth and accessing sports. So those are just like the people can't be who they are and play sports, go to the bathroom, do those basic level things. In terms of Title IX and HUD, so those are federal laws, federal policies, federal guidelines. Title IX is about schools up through college level, and they ended up allowing more discrimination against folks of specific gender identity, so trans folks, and around sexual orientation. And so the Trump era had made that discriminatory, and the Biden agenda reversed those and moved them back into a protected class. Same is true for housing and urban development. So a lot of folks that are in shelters or provide shelter are funded by HUD. So right now, discrimination is not allowed against trans people. It still happens, but it's not allowed on a federal level if you receive HUD funding.
Yeah.
So those are, that's the nutshell.
Yeah, I appreciate that. And I also I'd be interested to know the ways that people are affected by this, right? Trans folks are affected, because I think sometimes we hear these things, we hear them and they're kind of static and they're statistical and they're political and policies, but to know the impact that it has on individuals, I think is critical to the type of empathy that we need to develop in order for us to really be moved,
And you know,
Yeah.
you know, everybody talks about bathrooms, I think, way too much, but it's
Mm-hmm.
really important, right? Because like, how does that move people? Like, if somebody said to you or anybody else, you can't go to the bathroom all day because we
Mm-hmm.
aren't going to let you in the bathroom. I
Mm-hmm.
mean, what does that do to your body and your mind, right? So it
Mm-hmm.
has practical implications.
Mm-hmm.
You know, all of these things that we don't seem to think of as big deals, they're big deals.
Mm-hmm.
Yeah.
So we got 5 minutes left, but
Okay.
there's a couple things. You know, like what's a call to action? What is something that you can like, you know, share with folks who are listening and who will listen, because this IG Live is going to be saved on our YouTube channel, but they'll be able to access it, probably in like a prettier version after Jordan like works and edits on it.
Yeah.
But in a way for you to just like get this information, what is like a call to action? What are some resources that people can
Yeah.
identify with, you know, or just seek out themselves. Like you don't have to
Hmm.
break it down. Like
Yeah.
people can use Google, but like some direction that people can take with them after listening to this conversation and thinking about the ways they can be more considerate and supportive of trans folks.
Yeah, no, that's really cool.
Mm-hmm.
So I would encourage folks to follow Forge. This is not about Forge's stuff, but like, you know, find us at our website, which is
Mm-hmm.
forge-forward.org. Lots and lots of free training there. You can contact us on social media as well. So, I mean, those are like two places that you can get more trans-specific information. Let me share a little bit about what Men Healing and Forge are doing, which is
Mm-hmm.
trans-specific. So we didn't really get to talk about like, you know, Men Healing is really expanding things around trans access because
Mm-hmm.
there's such a void of services for trans folks. So let me just share with you a couple of things that are going on. So we're doing a trans and non-binary speak out. We've got 10 participants. It's very similar to the story project that Men Healing
Mm-hmm.
did this past year. So we're really excited. We're starting on December 2nd, and we'll have a premiere in March and April of next year. So that's like a piece of excitement between the two organizations. We're also going to be doing a trans-focused day of connection in June of 2022. We will do some mixed media art workshops as well, Men Healing, and I think Forge is part of that. I'm not sure if we're doing that jointly or if we're just promoting the trans focusedness. And there's a new Beyond Survival video that just landed with Tristan, and it's a fantastic video. So those are some things that we're doing with Men Healing to support trans folks. And all of those things, of course, cost money. And I know that this is part of this 90 and 90. And just to give you an example, like the Speak Out that we're doing, it costs about 60 grand for us to put that together for staff time, for what it means for folks, you know? So if folks want to donate, it can go towards that project. Or if people want to support the Day of Connection,
Oh. Mm-hmm.
it off now.
Yeah. Mm-hmm.
So the Day of Connection, people can support that as well. Same with the mixed media. So there's plenty of places that you can kind of earmark your money if you want to even say what it's for. But every dollar counts for those things because, you know, we want to make sure that trans folks who are oftentimes poorer than the average American can access those resources for free or for really low cost.
Absolutely, absolutely. Yeah, I'm glad you ended with that because that's something that we you know we've been reiterating every week is the fact that like all of your dollars, the money that you donate, it really goes directly to services. You know, Men Healing is ran by, you know, and the work is being done by folks who are for the most part is volunteers, right? Who are really committed to this effort. Like your money goes directly to the services, maybe a small portion to like make sure people can get to the destination that they need to be and like feed them. But at
Yeah.
the end of the day, it's like folks who are just committed and volunteering their time. So just know that like any money that you donate to Men Healing, especially over this course, you know, particularly over this course of this 90 days, 90K that we're trying to reach that mark of, where that would allow us to offer just on the strength of like focused on weekends of recovery, like, you know, 100 survivors will be able to access those services, right? And just know that. And just know that, as Michael was saying earlier, as Men Healing continues to expand, focusing on trans folks, non-binary folks, on men of color to be more accessible to these populations that have not been, you know, historically served because of many of the challenges they face financially, your donations will make that possible. Your donation will give us an opportunity to provide these services, and no one will be turned down regardless of how much money they have, how much resources they have. And especially going into this next week, we're Giving Tuesday on Tuesday, the 30th. Please think about that, how you can support our efforts, how you can support the work of Forge, how you can support the work of Men Healing. Michael, any last words, anything? Or
No, I mean, just to add on to what you just said, it's like, money that's donated really goes to the people that need and want and deserve services. And, I mean, if people care about trans issues, that's great. If people care about male survivors, that's great. If people care about both, that's even better. So yeah, I mean, every dollar does go to really supporting those survivors who are in need of services. And, we are all really committed to this work and continuing to grow and learn and be present for the folks who really need services.
thank you, Michael.
Thank you, Richard. It was good to see you again.
All right. Enjoy the rest of your week. And thank you, everyone, for listening and the folks who will be listening. Take care. Peace.
Bye.
Bye.